A scientist is studying mitochondrial respiration. After adding pyruvate, malate and succinate, respiration is normal. When another substance is added, respiration stops completely. Which substance was most likely added? Right answer is option B, oligomycin. Oligomycin blocks ATP synthase, preventing ATP production and eventually stopping mitochondrial respiration. A 15-year-old girl has myopic astigmatism and is not complying with spectacles. What is the most appropriate management? Right answer is option C, spherical equivalent spectacles. Since the patient is only 15 years old, refractive surgeries are generally avoided. Spherical equivalent spectacles are the most appropriate option from the given choices. A 75-year-old man has a small prostate tumor, PSA 9 nanogram per ml and a Gleason score of 6. What is the most appropriate management? The right answer is option B, active surveillance. This patient has low risk prostate cancer, so active surveillance is the preferred approach, especially in an elderly patient. A patient involved in a road traffic accident is hemodynamically stable but has tenderness in the left lumbar region. What is the best investigation? The right answer is option C, contrast enhanced CT scan. In a stable trauma patient, a contrast enhanced CT scan is the investigation of choice to detect abdominal and renal injuries. A 30-year-old woman develops flaccid blisters that rupture easily. Skin biopsy shows a suprabasal split. What is the diagnosis? The right answer is option D, pemphigus vulgaris. Pemphigus vulgaris causes flaccid, easily ruptured blisters and the biopsy typically shows a suprabasal split. A patient on multi-drug therapy for leprosy develops worsening of existing skin lesions along with nerve involvement. What is the next best step? The right answer is option A, continue multi-drug therapy and start systemic corticosteroids. This is a type 1 lepra reaction. Continue multi-drug therapy and add systemic corticosteroids to control inflammation and protect the nerves. A 30-year-old man is intubated for surgery. What is the best method to confirm the correct position of the endotracheal tube? The right answer is option B, end-tidal CO2 concentration. End-tidal CO2 monitoring is the most reliable way to confirm that the tube is correctly placed in the trachea. A patient under halothane anesthesia suddenly develops a very high fever and severe muscle rigidity. Which drug is most likely responsible? The right answer is option B, zooxanthonium. Zooxanthonium, especially with halothane, can trigger malignant hypothermia, causing muscle rigidity and a dangerously high fever. After a total thyroidectomy, a patient develops breathing difficulty and repeated attempts to remove the breathing tube fail. What is the most likely cause? The right answer here is option D, bilateral recurrent laryngeal nerve injury. Injury to both recurrent laryngeal nerves prevents the vocal cords from opening properly, causing airway obstruction and failed extubation. A woman has a blocked nose, foul-smelling nasal discharge and loss of smell. On examination, yellowish green crusts are seen inside the nose. What is the another likely finding? The right answer is option C, roomy nasal cavity. This is a case of atropic rhinitis, where the nasal lining and turbinate shrink, making the nasal cavity appear unusually wide. A roomy nasal cavity is a classic examination finding.